So I am comfortable augmenting. Buproprion, is something that I'm usually not going to it as a first line, but certainly I have used it to augment. Sometimes if people are really worried about weight gain or sexual side effects, I might go to bupropion as a first line. But yeah, I think it's a great to augment. I do look for blood pressure changes with that one. And aripiprazole is the other one that she mentioned, or just any of the second generation antipsychotics can be used. But I think aripiprazole specifically is one that you see people using for this.
Yeah, I like bupropion. I know the toxicologists hate it because the toxicities are so awful, but I will say that in young patients who do not have a lot of anxiety with it, who are worried about weight gain, who are worried about sexual side effects, and whose depression is mostly the kind of low energy type and not the anxious type, I think it's a reasonable medication to try if that's the decision that they make. I would also just throw out there, we didn't mention this in the episode, but just as a general reminder, has a potential to lower seizure thresholds. So, just because this comes up in some of the patients I take care of. So if there's someone who has a history of alcohol use disorder or a history of seizures, use with extreme caution or don't use at all, I would probably sort of throw out there. But there are cases where I would start with that one. But I agree with you, Matt. Those are ones that I'm more comfortable using as an adjunctive medication if they're already on the
Yeah.
SSRI that they responded kind of to, but just need to kind of get over that hump, then aripiprazole
Right.
or bupropion are both good augmentation options.